I mean, every time I put up a post and said, hey, they say red meat causes diabetes, I'll get 500 diabetics said, you know what? I went on
Everyone's
this diet.
cured. Yeah,
Yeah.
that's
And my
crazy.
diabetes went away. I'm off all my
Right.
damn drugs. I'm off of my metformin, my insulin, my SGLT2 inhibitor. I'm off all that crap. And I've lost 50 pounds and I feel great. And it's like, at some point you've got to, I mean, there's evidence-based medicine, but there's also results-based medicine. And I think we have to realize that the evidence that we base a lot of our decisions upon is not all that great. I mean, in many ways, I mean, particularly in nutritional evidence. I mean, it's hard to do really good, highly controlled, specific experiments on human beings when it comes to nutrition over a long period of time with good clinical outcomes. I mean, we might be able to look at a few biomarkers here and there, but I mean, and I tell people, people are asking me, hey, well, what if this diet makes you live shorter, or you get cancer, or you get heart disease? I'm like, well, I don't know. Maybe that will be the case, but there's no way to predict that based on any studies we're doing. There's no diet where you've got, we don't have a 50-year randomized control trial of twins locked in a metabolic ward eating one diet versus the other with everything else consistent. We never can do that. So at best, we're like doing these, large scale epidemiologic studies where you ask 50,000 people to fill out a food frequency questionnaire to ask them, what did you eat for the last 6 months? And it's always inaccurate. I mean, it's always bad data. And then we're like, well, maybe there's a generalized trend there. And then we'll get some small signal, maybe a relative risk of 20% increase or decrease in this or that. That's really garbage. That's really garbage data. So I'm like, I don't know. I have no idea if this diet will make me live longer or shorter. But what I do know and what I can see is I can take someone who's profoundly sick and make them profoundly better over a short term. And I think that's incredibly valuable. And so I think if you can use that as a tool, and then you can kind of say, okay, where do you go from there? I mean, do you think the person who has intractable depression where they can't get out of bed and they're suicidal all times cares about heart disease in 30 years?
Right.
That isn't even remotely what they're thinking. I don't think they're going to live a year. So you can take those people and you can get them significantly healthy to where they return to a normal functioning life and they can, rejoin their family and all this stuff. And I've seen that for almost every condition you can think of.